Hello everybody, today is Wednesday the 18th of March. My name's Lauren and I'm a recent graduate of the university and now a current staff member. And at the university we've had a lot of questions around coronavirus. So I'm talking with Professor David Green, Vice-Chancellor and Chief Executive of the university, and Dr. Claire Jones, who is an experienced general practitioner in the Worcester area.
So, Lauren, you're right, we've had a lot of questions about what the university is doing in terms of the coronavirus pandemic. And earlier today, I announced that the university, which has been following government guidance and been operating as normally as possible in this very unprecedented time, that we're going to be moving to online teaching and learning from Friday. But of course it's the case that we'll still have many students continuing to live at the university in halls of residence, halls which are their home, and that people will want to use the study facilities of the university, which will remain open. At the same time, we're going on with all of the precautions and the activities which we've already adopted, promoting social distancing, for example, when people are studying or are in class, and we're also fielding many questions from students, and I have to say sometimes from anxious parents about health-related matters. So I thought it would be very helpful today to invite Dr. Claire Jones, who's a very experienced general practitioner here in Worcester, who runs a busy inner city general practice to which I know some staff and students go, but many members of the population, to come and answer many of the questions that we're being asked as a university by students. And of course, we're not medical authorities, but we do have many friends who are, and therefore Claire will be answering a number of the questions which people ask frequently to us. And as we all know, we've been asked if we do have the symptoms of coronavirus, not to go to the hospital, not to go to our general practitioner, but to be in contact with someone over the phone. And so this is a service that the university is providing, courtesy of Claire, to help people with the questions which are very often asked.
So firstly, it might be helpful to clarify, what are the main symptoms of coronavirus?
Well, so coronavirus is different from a simple cold in that simple winter colds tend to start with a runny nose. This is not what we're seeing with coronavirus. So we have a lot of knowledge about coronavirus because of all the cases in China, in all the cases in Italy, in France, and now it's coming to the UK. We're seeing our own cases. But the first symptom appears to be a very high temperature, so a temperature above 37.8, which will make you feel very, very hot and sweaty and uncomfortable, different from just a flush. And even if you haven't got a thermometer, you'll be aware that you've got a very high temperature. That will not be a symptom you can ignore. So usually with a common cold, you're unlikely to get a temperature. With coronavirus, you get a very high temperature. The other predominant symptom is a new persistent cough that's dry. So not a cough that you've had since Christmas, with your Christmas chesty cough, but or a cough that's been part of your asthma or your chronic airway disease, but a new persistent cough with at the same time as your temperature.
So how do I know if I'm in an at-risk group?
Well, Public Health England are telling us that everybody over the age of 70 is at risk. In addition to that, as a general rule, if your surgery offer you the annual flu jab every year, you could probably consider yourself an at-risk group. There'll be many students who've had illnesses in the past and they'll wonder, oh, does that still put me in an at-risk group? But actually, if you're not getting an annual flu jab, you're probably not in an at-risk group.
And if you think you're starting to experience some of the symptoms, what should you do?
So if you have mild symptoms that are just a runny nose or a cold, you don't need to change anything. If you have symptoms of coronavirus, so a very high temperature and a persistent cough, then you should look on the 111 website, which will give you very clear, strict instructions about isolation, and isolation for 7 days and isolation for 14 days for your household members. But if you look on the 111 111 website, it will give you very clear directions. You can put your symptoms in there and it will give you some good instruction. It will also then at the end of the website tell you to ring 111 if you've got any further concerns. But 111 are being inundated with calls. They're finding it really difficult to cope. You can always ring your doctor's surgery. So most of our appointments now have been changed to telephone appointments, and lots of our patients are ringing us with advice. And we, of course, have their medical details. We know the patients and we can give them really good, clear, sound advice that fit in with the advice that we're getting from Public England. So ring your surgery. We're there to take your calls. We're asking you not to turn up to the surgery because we're trying to keep our waiting rooms free of coronavirus. But if you need to be seen, we will see you. But we may meet you in the back in the car park, take you around a back entrance, take you into a consultation room that we can then clean afterwards. So even if you need to be seen, we'll see you, but we'll want to speak to you on the phone first. But hopefully most people will just have very mild symptoms that they can deal with by taking some paracetamol at home and getting advice off the 111 website.
So there's lots of mixed messages around self-isolation. Some say 7 days, 14 days. There's been mixed messages. Could you offer further clarification on this?
Well, I think you just have to look at the 111 website, which will be updated every day, and announcements are coming out every day. I understand the advice at the moment is if you are a potential case of coronavirus, then it's strict isolation in your household for 7 days, but with your family members isolating for 14 days, because of course there's an incubation period of, probably 5 days when you could actually pass it on to a family member. But I think that guidance will be being updated every day. But if you look on the 111 website, then that will be clear.
Now, there may be some people dealing with anxiety around the situation. Do you have any tips for how people can manage this?
Well, I think if you're if you're anxious about how coronavirus will affect your daily life, we're all anxious about that, and it's a matter of just looking after ourselves, looking after our loved ones, looking after each other. And of course, it's only physical distancing that we're trying to achieve to reduce the spread of the virus. It's not actually social isolation, and most of us are socialising all the time, on social media, and so it's keeping in touch with each other, looking after our elderly relatives, setting them up on Skype, looking after our neighbours, making sure that they might need a bit of shopping done for them if they want to stay home and stay isolated. And I think keeping fit is the most important thing. So you can still exercise, can't you? Go out for a run, go to the gym.
Is there anything else we can be doing? So there's been a lot of advice on washing hands, social distancing. What else can we be doing to be responsible?
Yes, so young people and children are very unlikely to be seriously ill with this illness, but we're trying to protect our elderly. We're trying to reduce the potential death rate from coronavirus from 250,000 to 20,000, and we can do this by reducing the spread of the virus. And it's the young people and children that contribute with the spread, so it's about physical distancing, staying a metre apart, and if you have any symptoms, being very strict with your isolation.
So we know what we can do. What are the NHS doing around this pandemic?
So the NHS is putting an enormous amount of resources into this virus, taking it very seriously. We are seeing it coming, and we've had, there's lots of models from China and from Italy, from Germany and France, which are helping us, helping Public Health England guide the plans, but the NHS is stopping all its routine work, stopping any unnecessary work, and patients being asked to self-treat. So I think it's reducing the strain on the NHS with health problems that don't need sorting out in the here and now, allowing the emergency service to do what they're doing. So not pitching up at A&E without having rung them first, that's the most important thing. Not calling in ambulances that aren't necessary, so they're under a lot of pressure. And GPs, we're here to help you, but ring us first, and there's a lot we can do over the phone. And actually, the last couple of weeks now, we're doing video consultations. So even if we need to see you, we'll, set up a video consultation. There's a lot we can do that way.